SunRISe-4 trial was a trial testing the combination of gemcitabine intravesical system, TAR-200, and Cetrelimab, or Cetrelimab monotherapy, for 4 courses every 3 weeks before radical cystectomy in patients with clinical T2, T4, and M0 muscle-invasive bladder cancer who are ineligible for or refuse cisplatin-based chemotherapy. The interim results have been presented last year in our session at ESMO, and published a few months ago in Lancet Oncology. And here we presented the primary findings and biomarker results. Primary findings actually confirm the initial findings. 38% of the patients achieved a pathological complete response with TAR-200 and Cetrelimab, as compared to 28%. And the response, major pathological response, was as higher than 50%. So quite promising and confirming the initial findings. No new safety signals emerged at the primary analysis, and most importantly, we got the initial data on biomarkers focusing on the UTDNA, urinary tumor DNA, and ctDNA, circulating tumor DNA, that were assessed at baseline and at week 12 post-neoadjuvant therapy, just before cystectomy. First, UTDNA. UTDNA at week 12, so post-treatment, emerged as a strong biomarker predicting the pathological complete response in radical cystectomy. First, the clearance of the ctDNA in patients who had the pre-post comparison of the samples was also associated with pathological complete response. Interestingly, ctDNA, which was confirmed to be clearly associated with relapse-free survival, so survival outcomes, longer-term outcomes, was not associated with the interim endpoint of pathological response. So the results combined, the treatment standpoint of combination therapy and the biomarker standpoint of UTDNA and ctDNA are pretty well manageable, because they are putting each one single step towards a potential improvement in the management of these patients regarding treatment and regarding the potential for predicting pathological response with UTDNA and outcome with ctDNA. So the ideal setting, the ideal premise, I think, for the next generation blood sparing approaches.